Welcome to my channel, and I have decided to present small courses and talk about everything and every detail about these clinical cases and how to manage them. So the first thing we are going to talk about is such class 4s. How are we going to treat the patient and plan for the treatment, and step by step on how to make the decisions and on how to treat such a case. For example, I have here a class 4. Okay, so let's talk about this class 4. So first of all, before starting, I have to know several factors. For example, here, what do I have? I have a large class 4. So I want to treat this tooth, but what should I consider before treating this tooth? I have to look for the adjacent central incisor. Here I have some factors. I will take these factors and I will go ahead and do my restoration according to that. So, for example, I have this class 4 and I have this tooth which is sound. I have no fractures, I have nothing, no erosion, no problem whatsoever on this tooth. So in order for me to restore the adjacent tooth, I have to take data from this one. So what do I have? Incisally, I have like a zigzag. Okay, so this is the first thing that I need to know about the incisal edge. Then I have incisal halo, which is an opaque line on the incisal aspect of the tooth. So this is the second thing. I have a fair amount of translucency. Incisally here, I have a fair amount of translucency. And also for the shade selection, I have to select the shade based on this tooth. Okay, because here I have fracture. I might not be able to select the shade of the enamel because I have a big fracture here. So I will use this tooth to select the shade. So as we said, I have to look for that. So this is the first thing. The second thing that I have to look for is the fractured tooth itself. Here I have a fracture. I have scratches of the old composite. So this tooth was previously filled with composite, but it detached from the tooth, and the patient is now demanding a new work. So we have previous scratches. So in this case, I decided to go for direct veneer because the patient, I think, was 16 years old, so no need for crown and veneers. So when you look incisally at the tooth, this one was a little bit behind the left central incisor, so we decided to make direct veneer for this one and also add some composite to make the level of the teeth the same. Why we need to do that? Because then we will need transitional line for us to be able to produce a transitional line that is symmetrical. We have to make the teeth on the same level. So this is my treatment plan and how I decided to restore the tooth. Okay, first. Second, I will isolate. Of course, I will do my isolation. The advantages of isolation are, first of all, I have better access. I have better visualization because I have light reflection, and also it's more hygienic, and the result will be much better for me if I use isolation, because I will have no blood, no saliva, no incidence of the patient biting or touching it with the tongue. I have none of that. So before starting, I have to do my shade selection. So just keep in mind, don't make your shade selection on the rubber dam for two reasons. You have light reflection, more light reflection than usual, because the rubber dam reflects light. So this is tip number one. This will make you will make a mistake of selecting the wrong shade because of the light reflection. Second, when you isolate the teeth, most of the time you take more than 3 minutes. So when you take more than 3 minutes, the tooth will desiccate. If the tooth desiccates, it will become brighter, and the shade selection will be brighter, and the result will be horrendous. So also always make sure to make your shade selection before starting. So for the shade selection, let's go back to the first picture. For shade selection, I have two shades to select. I have dentin shade and I have composite enamel shade. So for the dentin shade, I will put buttons of composite here and here, and I will select the shade of the dentin that I'm using. Why here? Because I have the thinnest enamel and highest dentin radio opacity. And for the enamel shade, I will put 3 buttons of enamel composite shade, and I will select the shade of the enamel on this area. Okay. So, regarding the bevel, as I said, I have to do a beautiful 2 to 3 millimeters of bevel, okay, just like this. And I need to hold a red color-coded burr with a degree of 45, with an angle of 45, to expose the enamel prisms that I have here, because if I expose them correctly, after etching them, I will have a beautiful micro-mechanical retention, and I will have micro porosities in the enamel, and I will have a beautiful bond on that surface, strong bond, strong adhesion, and also I will blend my composite more perfectly with the natural tooth. Okay, so now as we see here on the tooth, I did my bevel just the way I said we will do it. Here is my bevel. Okay, so this is the bevel that I did with the burr. For me to refine my bevel, to make it more beautiful, more smooth, I need what? I need to correct the bevel with an abrasive disc. Of course, this disc has aluminum oxide, and I will correct the bevel, and I will smoothen the bevel with this disc. I have sharp areas, I will smooth them with the disc. So this is another trick for a class 4. Here, as we said, I decided to make direct veneer for the entire tooth. So after finishing the bevel, I will etch the entire tooth, and I will start with my palatal shell. So the palatal shell here, I used a composite called OBN from my serum, OBN. Here I created the zigzag that I have on the adjacent tooth, and here I use a translucent enamel because I have translucency here, so I have to create translucency on the adjacent tooth. So with the help of a silicone index, I will do this step. After that, what do I need? I need to recreate some features. So I have to support my enamel palatal shell with composite. Here, if you can see, I have flowable composite to support the palatal shell to avoid any fractures of the palatal shell because it's not supported. It's a thin enamel layer of composite. Okay, so it will break easily if I do not support it. So I support it by a little bit of flowable composite. Then I will recreate this incisal halo with OPA2 from Tokoyama because it has the highest opacity and I need opacity in that region for me to be able to recreate my incisal halo. And here also I use enamel shade to recreate. Here I think I used A2 enamel shade. It's all according to your shade selection, of course, to recreate my distal wall. So now when I finish, I have a beautiful box and I can start my layering technique. Okay, in this case, the first layer of composite that I used was also OPA2. If you can see here, I used OPA2. This is OPA2 composite because I have a large fracture. I have large like class 4 fracture. The shadow of the patient's mouth will make my restoration gray if I don't compensate with an opaque composite. So here I used OPA2 composite as a very thin layer, not too much because it will be very opaque if you use too much. Then I will do what? I will compensate with my dentin shade and also create the mamelons that I need. Here I need, in the central incisors, we have 3 mamelons. I have 1 mamelon already, so I have to create 2 more mamelons. This is 1, this is 2. So here, according to my dentin shade selection, it was OA2 from Tokoyama. So I compensated with these dentin shades. Okay, this is mamelon number 1, this is mamelon number 2. Sometimes you can make a split in the mamelon to make it look more natural. And I left these spaces. Okay, so I leave these spaces for my translucent composite to fill them and create my translucency later on for the class 4. Okay, now I filled these spaces with the translucent composite. Okay, you can see it here. I filled it with color clear composite from Tokoyama. I don't want to lose these spaces because I will make a beautiful translucency here later on. And finally, I will place my enamel on the entire tooth, and this is my final result. As you can see, I have what? I have beautiful transitional line. These are my transitional lines on the teeth here and here also. So I copied everything. I have a beautiful opacity incisally. So I created my incisal halo also. And as we said, the zigzag also was created. So for a class 4, this is the only thing that we need. It's not complicated. You just need to understand the shades of the composite that you are using. You need to understand what shades you need after you select the shade. So for such a result, you need to know the composite that you are using, you need to understand the shades, you need good cavity preparation, and you need good polishing system. We will talk about them on the later videos. But as we said, a class 4 restoration is not very hard. You just need to practice. You just need skills, okay? And most importantly, you have to understand the composite shades that you are using. And also, it's not only about composite shade, it's about how you layer the composite and how you polish them and how you recreate the optical properties and characterization of a natural or an adjacent tooth.